Well, whether you're an athlete or just trying to stay active, shoulder pain can slow you down. Joining me today to talk about some of the causes of shoulder pain and, more importantly, what can be done to treat it, Dr. Richard Busch from Busch Chiropractic. So great to see you today.
Great to see you as well, Alyssa. Thanks.
So why don't we kind of start with what are some common problems that people have with their shoulders?
Well, everybody's heard of a rotator cuff tear, which is basically one of the four muscles in the rotator cuff that actually controls fine movements of the shoulder. But along with that, you probably have heard of somebody having something called frozen shoulder syndrome, which is the medical term for it is adhesive capsulitis, which basically means that the joint capsule kind of thickens a little bit and becomes, there are adhesions around in between the fascia and the muscles and everything else, and that causes everything to stick together. Some other things are things like arthritic changes to the acromioclavicular joint, which is right up at the top of your shoulder. We also see patients that have problems with like tendinitis of their elbow for things like tennis or golfer's elbow. And so those are all things that can actually create the problem. A lot of times patients that develop things like adhesive capsulitis may have developed it as a result of not moving for a period of time. A lot of times the patients that have developed the rotator cuff tears may have done that as a result of working with their arms over their head or being jerked in some way, shape, or form to cause one of those fine muscles to tear a little bit.
So what are some of the treatment options that we have? Surgery is not always the answer.
In what I do, surgery is always the last answer. So we're always trying to help people avoid any type of a surgery if we possibly can. So there are a lot of different things. First of all, you can obviously do things like stretching exercises. Those stretching exercises will actually help loosen the muscles up and also along with that help get the joint moving again. But then along with that, when the stretching exercises and icing doesn't help, there's some other things that we do in my office, and that deals with everything from different types of therapies, whether it's like a cold laser or whether we're using something called extracorporeal shockwave therapy, which basically helps break up the scar tissue adhesions and arthritic changes. And along with that, we even do some manipulation. But there are some other cases where the problem may actually start more close to the spine, which is obviously where we deal with a lot of problems as well.
Right, because sometimes it might be painful in your shoulder, but it's actually coming from your back.
Exactly. So you could have a disc-related problem in your neck as well. The neat thing about it from a result standpoint, or I guess the amazing thing about it is probably a better way to say it, is those patients that have lost the movement of their arm for like frozen shoulder, we can actually help regenerate that to get them back to normal activity level with full ranges of motion. A lot of the arthritic changes that we see can also be reversed in some way, shape, or form, or actually at least dealt with so the patient can get back to normal motion without or with a little bit of pain.
Right.
And we can do the same thing with golfer's elbow and tennis elbow as well.
Lots of solutions for a lot of problems.
Exactly.
Thank you, Dr. Busch. We
Thank
could
you very
talk
much.
about this all day, but we are out of time for today's Medical Minute. You can learn more on buschchiropractic.com. Pat.